Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening, viewers. Thank you so much for allowing us into your living rooms this evening. My name is Dr. Joseph Gavin Nyanzi, your host this evening on your week's favorite health talk show, the Doctalk show. Yes, as always, we say that health is wealth. So ours is to partner with you in this cause to make sure that actually we give you as much information as you can get so that you keep healthy. And that can be a very good foundation for building a wealthy life. And in studio with me this evening is there are two guests who are going to be giving us information about a very important issue in our lives. I have Dr. Nelson Kalyesubula. He's a dental surgeon working with Jubilee Dental Clinic. Dr. Nelson, you're welcome to the show.
Thank you, Dr. Gavin.
In studio with me also is Mr. Robert Kironde, who is a dentist working with Dino Dental. Robert, you're welcome.
Thank you. Good evening, viewers.
You all know what we are going to talk about this evening, and that is to do with oral hygiene. You know, usually during the festive season, I know Christmas is around the corner, there is a lot of work we do with our mouths. And needless to say that we got to have some information how we need to take care of our teeth. And that's why Nelson and Robert are in studio today. We're going to be discussing oral hygiene. What do you know about oral hygiene? Probably the information you've been having all along is wrong information. We've got the specialists in studio and they're going to be giving us all we need to know about this very important issue to do with our lives. Yes, Nelson, I'll start with you. What is this thing called oral hygiene?
Thank you, Dr. Nyanzi. Oral hygiene, if I'm to break it down in simple terms, it's just the state of how clean or how well kept one's mouth is.
Okay.
It's as simple as that. It entails how the teeth are functioning. Are they okay? Are they looking okay? Are they in good state? The associated soft tissues, which is the tongue and the cheeks and the gums, are they in good state? How well they are? Are they clean enough to function normally and perform to the levels we expect them to perform?
Okay.
That's how, in simple terms, that's how I'll break it up.
What would that entail? How would somebody keep their mouth okay, their teeth clean, their gum okay, their soft palate or hard palate fine? What are the steps? What do we go through to ensure that happens?
I would split it into mainly two parts. There is one which is at a personal level.
Okay.
I would say that's the home-based, the personal home-based oral hygiene care. And then the other one could be at the professional level when you visit your dentist to help you sort out your oral hygiene or to help you sort out an issue with your oral hygiene. If I'm to throw a little bit more light on the home-based practices, they involve things like, we all know we brush our teeth, we should brush our teeth. We'll go into some little bit later.
Okay.
I'll just outline them. There's brushing of teeth. There's cleaning of teeth using other aids like floss, dental floss, which are threads that we use to clean between teeth to remove the particles that would have stuck between the teeth. Then other cleaning aids like tongue scrapers to clean our tongue.
Okay.
And tongue cleaners on our toothbrushes to clean our tongues.
Okay.
Then also other, depending on your condition, the condition of your mouth, you might have to use things like mouth rinses, but preferably prescribed by a dentist.
Okay.
It's not that you should just go and buy an antiseptic mouth rinse.
Okay.
Then of course, when you're doing the brushing, you need to use a fluoridated toothpaste, a toothpaste with fluoride, because of the well-known benefits of fluoride in the toothpaste.
Okay.
Yes, please.
Wow. So oral hygiene involves two aspects: what you do at home on a daily basis, and then some instances when you have to visit a specialist. Robert, I guess when one is very thick with their oral hygiene, then you expect them not to lose their teeth. How many teeth are we supposed to be having? A child, an adult, how many teeth is someone supposed to have?
Before we think about how many teeth an adult and a child is, I just wanted to add on something on with his definition.
Okay.
The truth is, if you, in simple terms, we are talking about the health of the mouth. And we are talking about the health of the mouth of a child and an adult. When do you start thinking about the health? I tell my children, hey, you guys, when you go to your boyfriend's home, look at their teeth. Yes, when you're thinking about the health of your child in the future, you start thinking about the health or how good the teeth will be of your child before birth. Because there are so many genetic conditions that somebody can come up with, and they can disturb you all your life. So I usually tell them, hey, you guys, look at their teeth. If you don't like them, their children are going to get those teeth. We have conditions like dentinogenesis imperfecta. We have conditions like amelogenesis imperfecta, which can come up in adult. So before you think about before you start cleaning that bowl with child's teeth, start thinking about before you give the birth to that child. Two, there are issues of STDs, like syphilis, chisel-shaped teeth that will come out in adult. So we are thinking about, when we are thinking about healthy teeth, we go back. We don't just jump into the teeth and start thinking, when should I brush? But what will happen to this child before this child is given birth? Now, when the child is given birth, okay, you've seen people are okay, people have been okay, and you checked your STDs, you don't have anything. There's also this issue of oral sex. There are people get diseases from oral sex. And they have these diseases in the mouth. And then when they have this child, they kiss gafura. So you're already affecting the health of the mouth of this child. By putting your mouth on this child, yet you involve yourself in oral sex. So you start thinking about how, even as this child goes, there are different issues that arise that you should take care of when you're thinking about the oral health of this child. One, for example, when you're beginning breastfeeding, I tell mothers, and I don't know why midwives don't tell the mothers about this. When you're breastfeeding, please finish the breastfeeding with water. Train this child that whenever the breast is done, you finish with water. What will the water do? The water will cleanse in the mouth when this child is still an infant.
Okay.
Now, there are some bad feeders.
So you're trying to say that oral hygiene is started when we are still babies. That's when we begin talking about
even before you get this baby. If you're somebody thinking about the oral health of your child, start looking at the genes you're going to get the child from, to look at the diseases you have.
Okay.
Because sexually transmitted disease,
STDs can affect the oral hygiene,
the oral health of that child.
Okay.
Now, when we go further, when this child has started breastfeeding, some mothers sleep with this breast in the mouth. Or if the child is a bad feeder, they will give a bottle, and this child will sleep with the bottle in the mouth.
Okay.
So we get this issue of bottle caries when the child is growing up. All the teeth will get burned because when there's orange sugars in the mouth, The bacteria will feed on these sugars, produce acids. The acids will burn down the teeth. That is, these are people you see with small brown teeth around the whole mouth.
First, I'm going to cut you short right there. This is very interesting. And quite a lot of information is coming out about oral hygiene, which is not just about your teeth, but you're talking about your tongue, talking about your palates, your cheeks, your gums, and all that. We're going to take a break, and we'll be back in a moment. I would love to appreciate the National Medical Stores and Carmelin Men's Collection, who are making this show available to us every Thursday. Thank you. Guys out there, it's Christmas time. Please go and check out on Carmelin Men's Collection. That's at the Zebra Plaza. That's at the junction where Entebbe Road starts. Yeah, and you'll, look very, very smart. Otherwise, we'll be back in a moment. Thank you very much.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you so much for keeping it here with us this evening, and we are live streaming on our YouTube channel as well as our Facebook channel, the Doctalk Show. Share this link with your friends, share this link with your family members, and let them join in, and let us be empowered together. Tonight, those that are just joining in, we are talking about oral health, and I have two dental specialists in studio with me, and they're going to just break down this thing for us. Before we break off, Robert, you were telling us about the issue of how bottles or mothers who keep the breast in the mouth of the baby at night can affect the babies. Please pick it up from there.
So I'm telling the mothers, before you begin thinking about brushing the teeth, the oral hygiene, you yourself as a person, you should think about the oral hygiene of this child by making sure you breastfeed not throughout the night, or you don't bottle feed throughout the night.
How does that affect the teeth?
When there's always a supply of food, bacterial food will feed on the food, produce acid, and the acids will burn down all the teeth that come into the mouth.
Okay.
That is why you find some children have small black teeth.
So they shouldn't do the feeding throughout the night.
Yeah, it's not about syrups alone.
Okay.
These children who always have syrups also have the tendency of that. But it basically it's on having sugars in the mouth throughout the night.
Wow, thank you very much. Nelson, please pick it up from where Robert has ended. Health, looking at the oral hygiene for babies, for children, what are the important things we need to look out for, as well as the adults as we continue with this conversation?
Okay, just to add on to the bottom mouth caries Robert has just talked about. Actually, bottom mouth caries are more dangerous in the night than during the day.
Okay.
In the night being that when we go to sleep, the salivary flow or the rates of saliva in our mouth is depleted. Remember, saliva helps us to cleanse our teeth as we eat food, as we drink something. It helps to cleanse our teeth, to wash off whatever is staying there. Okay. So when this kid goes with the bottle, who's given the bottle as a pacifier in the night to sleep with, then it's getting them into the state of really having accelerated caries, like accelerated bottom mouth caries. Okay. So it's always prudent to try to check or control the rate or frequency of bottle feeding in the night. I always tell parents, because I share with parents, and they tell me, Doctor, but this kid can't sleep without a bottle. I'm like, okay, you can't do that, but it's important, like Robert emphasized, after the bottle, you supplement it with some water. In the bottle, so that it cleanses off that. Yes, and then that's the babies. For the children, children at a given extent, they are able to perform some little brushing depending on their age. The guidelines or recommendations actually are funny, because the last time I checked, they were recommending that you brush the kids' teeth up to 8 years. I don't know how many parents do that.
So when do we start brushing the baby's teeth? At what age?
Brushing, or actually it's not brushing teeth, but cleaning the mouth.
Cleaning the mouth.
Cleaning the mouth should start as early as, I think, when the kid is born. Okay. I always tell parents, it's simple. You don't necessarily have to use a brush. Irrespective of whether the kid hasn't yet gotten the teeth, just get a clean piece of cotton or gauze, wrap it around your first finger, soak it in water, clean water, then just scrape around, rub around the tongue, the gums, and the cheek. That helps to remove the plaque off the tissues. And then once the plaque is off the tissues, then you'll have good oral hygiene and you stand less problems. Like inflammation of the gums and the sorts. For kids around, when the kid develops the teeth, that's at around 6 months.
6 months?
That's when the first, ideally that's when the first teeth begin coming in. It can be more than that or below that, depending on one's genetic makeup. So that's when more vigorous, the kid should be acclimatized to more vigorous teeth cleaning aids. You can start introducing them to toothbrushes. They have their specific toothpaste for their given age brackets, the junior toothpaste, slowly by slowly. But I always emphasize to patients that during those early childhood days when teeth have erupted, irrespective of the toothbrushes and toothpaste for the juniors, you still have to complement it with what I described before, the cotton or the gauze wrapped around the finger to clean. And then using the toothbrush should be cautiously taken on to avoid injuries.
To the gums.
Because those kids don't know how to move the toothbrush around. They can end up injuring their gums, and it will really kill the habit. Then as the kid transits 4 or 5 years, more of the brushing now should be emphasized. And preferably 2 times a day. Morning, after their breakfast, and then evening, after supper, before going to bed. It's very, very important never to sleep without brushing. Because once you sleep with that food in your mouth, remember we've already seen that saliva flow is depleted. You're going to stand a high chance of getting caries and decay and other mouth problems. And remember, bacterial activity is on peak in the night.
When you're asleep.
Yes, please.
Wow, that is very, very important. 2 times, at least. You can brush more, but you shouldn't go below 2 times. Whether you are a child or an adult, 2 times. Before going to bed and in the morning after the breakfast. That's what the specialists are telling us this evening. Robert, about the children, there is a category of children, a number of them who are autistic. Would there be a special care for the teeth, the parent and the child, or how do you, I know you've handled a number of them, how do you do that?
Before I go to the autistics, I just want to add on a little of what I said. If you want your children to be smart, try to be smart, because they'll copy you. You are their God. So I in these last 20 years of my experience, I've found out that if you go to the bathroom and you brush while your kid is, you give the kid the brush and you brush while they are looking, they tend to copy you. They tend to copy their God. They tend to do it more perfectly than you really going there. So you help the brushing should be supplement you as a parent, but teach them how to brush on their own by establishing a routine in the house. That before we go to bed, let's go and brush. All of you enter the bathroom. It is okay the parent to be in the bathroom of the kids. Then all of you brush. They will look at their God. They will like their God. So, as parents, this is a reminder that if you don't brush your teeth, if you don't brush your shoes, your children will not brush their shoes. If you don't brush your teeth, your children won't brush their teeth. So as a parent, you are their God, begin, they will do it perfectly well. So as with us autistics, we should,
what has been your experience?
We should appreciate that these people are different. The bottom line is these people are different, so we should handle them differently. 2, these people, when they get a bad experience, they don't know how to forgive. They don't know. It's not part of them. So once they get a bad experience, they will always run away from that bad experience. 2, even as we find it a problem while we're treating them, because they will not understand you always. So
What advice do you give to the mother?
There should be a balance.
Okay.
There should be a balance, especially the parents. The parents, you should always give the dentist time. You should always give the dentist time. And the dentist should always have time to play with this person so that this person gets the confidence. Because for them, they are different.
Okay. Is there any special care when they're at home?
Yes.
Home hygiene for the autistic children?
Yes. They should always be assisted. They should always be assisted. And when they come to the clinic, they should visit the clinic more often. Their oral hygiene should be done with the dentist. You can't do it alone. So the parents, you should find a dentist who eventually became a friend to this child. Somebody who will hug the child. Somebody who will play out the child until they get used to this person. So treating an autistic person or the oral hygiene of an autistic person is a process.
It's a process.
It is a process. You should visit the dentist much earlier before this person gets a problem.
Wow. What I'm picking from this conversation, parents out there watching us, big brothers, I know probably some families where their big brothers taking care of their little brothers and sisters. We, the adults, are supposed to be examples to these young people. So we can't talk about brushing before going to bed if we do not do it. So the only way it will be able to pass on to our children or our little siblings if we're able to practice it. When should we brush our teeth? In the morning, after breakfast, and in the evening before you go to bed at least. It's okay to brush many other times, but at least 2 times every day if you're going to keep your teeth all your life. We are taking a break, and when we come back, Nelson is going to be showing us practically how we do these things. You know, we have something right there in front of him. He's going to be using it to show us how we go about the brushing of our teeth. Keep it here with us. We'll be back in a minute.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you so much for keeping it with us. And special thanks to Carmelin Men's Collection and the National Medical Stores for making this show available to us every Thursday. Guys out there, Christmas season, please visit Carmelin Men's Collection at the Zebra Plaza along Kampala Road, with the intersection with Entebbe Road. And you will have a time of your life this year. We are here discussing oral hygiene, and we've so far come looked at a number of things, but in this particular segment, Nelson is going to show us how we do brush our teeth. Remember, we're not talking just about the teeth, we're talking about your gums, we're talking about the palate, we're talking about the tongues. So Nelson brought us something that will show us exactly how we go about it. Nelson, please take us out.
And really able to perform the cleaning they have to perform.
They should be straight.
I guess you've seen some toothbrushes which are bent, the bristles are bent. Those are non-functional. They will do the cleaning, but they won't do it the right way.
Okay.
The expected right way.
So
the
bristles must
should
be
straight and well functional.
Okay.
We need a toothpaste, and prefer the toothpaste with a fluoride in it, a fluoridated toothpaste. The reason why we emphasize fluoride, because fluoride is a very important ingredient as regards to the health of our teeth and the tissues in the mouth.
Okay.
Fluoride helps in what we call remineralization. It helps in attracting minerals back into the tooth.
Into the tooth.
Yes. And then also fluoride kills bacteria. It's known to kill bacteria by blocking off the pathways, all the lines in which bacteria need to survive.
Okay.
So that's why I always emphasize to my patients, I know there are very many toothpastes which are not fluoridated on the market, but from the knowledge I have and the experience I've had in treating teeth, fluoride can't be left out. You know, definitely you need clean water.
Clean water, okay.
So you apply your toothpaste on a toothbrush.
Okay.
People ask about the shape. It should be the recommended shape, size, all amount of toothpaste. You don't apply the whole entire bristles. You can apply a peanut shape. That's enough, good enough.
Okay.
To go on. Make sure that your toothpaste has been soaked, your toothbrush has been soaked
in water.
With some water.
Okay.
Then we start our brushing. There are very many techniques, but over time, from experience, I've noted that the rolling technique, whereby you roll your toothbrush over your teeth in small areas, you don't need to rush, is very effective for reasons that when you roll your toothbrush, it cleans, it gives you the vertical strokes, cleans also the in between areas,
okay,
and then also it has lesser effect on the neck of the teeth.
Okay.
Because very many people have what we call toothbrush abrasion because of poor brushing technique. The toothbrush can wear the enamel at the neck of your teeth. So you roll your toothbrush in such strokes gently as you're advancing it forward. When you finish the outermost surfaces, you also do the same for the inner surfaces. You roll your toothbrush. You roll it. You don't need to rush. Just roll it and take time and enjoy. So after you brush the inner, never forget also to brush the chewing surfaces, especially for the molars. That is also simple. You just roll, or you can just use the back and forth movements. You do the same thing for the lower teeth. And then one important thing is that you should always never ever forget to brush the tongue. Wow. Many people do good teeth cleaning, but then they forget or neglect the tongue. The tongue retains plaque, it's moist, it has bacteria. Then you brush well, but you keep wondering, doctor, I brush well, I always brush well. I ask you to demonstrate you're doing the right technique, but then you tell me, doctor, my mouth is smelling, and evidently when I examine, you have some bad breath.
Oh yeah.
It's because of the plaque retained on the tongue.
On the tongue.
Yes. The tongue can be cleaned. You can use the bristles, but then if you look at most toothbrushes, they have a rough surface at the back. That's called a tongue cleaner. So you just scrape that over the tongue. It will remove the plaque because it's over the tongue, the top surface of the tongue. If you can afford, you can also buy what we call a tongue scraper. Tongue scraper. They're available in supermarkets and pharmacies. That one it's like a rake. You just place it, and apply some little pressure over the tongue and drag forward. So as you drag forward, it scrapes off the plaque.
Do we clean the palate as well?
The palate, you could, but gently. I prefer using a very soft toothbrush, because if you use a hard toothbrush for the palate,
you'll
cause bruises or ulcers. You can.
But there's a lot of plaque on the.
The palate is smoother. It doesn't really retain plaque.
Wow.
Yes.
How have you been brushing your teeth? Have your friends been running away each time you approach them and begin a conversation? Maybe you've not been doing it the right way. I hope you've learned a thing or two which you're going to pass on to your children and your other friends and family members. Robert, that was quite impressive of Nelson. What other, of course we've used the toothbrush, he's talked about a tongue scraper. What other items do we need to use when we are performing oral hygiene?
One thing I've realized in my practice, I have seen 20% of the patients who come into a dental clinic actually have self-induced injury. For example, using a hard toothbrush in a wrong direction. When you brush like this, usually you tend to cut your gums, you cut the teeth. So people should, I am emphasizing on what he has been saying, please brush in a circular motion. Brush and gently. In a circular, gentle motion. And if you brush up and down, you'll poke the gum and push it out from the teeth. So there's also floss. Most people, when they go to a restaurant, they get a toothpick. They make it a habit. Some people think it's a fashion to have a toothpick in their mouth. Now, when you use that toothpick to remove food from in between your teeth, you poke your gum, push it away from the teeth. Bigger food enters, bacterial activity takes place, and you'll get cavities from under your teeth. So never ever touch a toothpick. I repeat, never ever touch a toothpick, because it strips the gum away. Bigger food will enter, bacterial activity will take place, and you will get caries under your teeth.
So instead of toothpicks, we're using floss.
Floss.
What is floss? It's a string.
It is basically a string that is used to move food from in between your teeth.
Okay.
Now,
gadgets we use?
You can buy floss from a supermarket, but if it's expensive for you, you can go to these gunias, these sugar sacks. It's only 800. It's only 800. You remove the string out, wax it on your candle. Candle is 500. Wax it and it's done. Then the tongue scraper.
Okay.
That chijiko or spoon you have at home can do wonders with tongue scraping. It will do wonders with tongue scraping. You can use the most important thing is put the chijiko in your spoon in your bathroom whenever you're brushing. Pull out your tongue and scrape it.
Okay.
Because that is the only way you can remove most of the bacteria and food from your mouth.
Okay.
Now the mouthwash. There's a problem. Is when people have bad breath.
Okay.
When people have bad breath, they'll always go to the supermarket and get a mouthwash.
Mouthwash.
Please, I repeat, don't just get a mouthwash and use it. Why? Because some of these mouthwashes have alcohol. If you use it over a period of time, it will dry your mouth and it will make your situation worse. Remember, when you have bad breath, go to a dentist, let them check. If you have cavities, if you have artificial teeth, let them remove the problem you have.
Before you use the mouthwash.
Before you think about the mouthwash. Before you think about depending on the mouthwash. Because there are actually 17 reasons of bad breath. So it's the body crying that is something wrong with me. So before you rush in to use the mouthwash, go to if you have bad breath, go to the dentist. If the dentist says you are okay, and you still feel you have bad breath, go to the physician, get to the ENT surgeon, talk to your dentist, let him refer you to the next step if you really have bad breath.
Okay, but so you don't just go and get a mouthwash.
Oh, okay. Yes.
Amazing. And guys, don't be selfish. Share the link, the Doctalk Show on YouTube, the Doctalk Show on Facebook. And if this information is really very, very beneficial to you, subscribe to our channels and encourage your family and friends to subscribe. We are still here. We're going to take a short break and we'll be back in a minute.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you for keeping it there in your living room. And we're here discussing a very important topic even as we approach this festive season that is associated with so much eating. And that is the area of your mouth. Nelson and Roberta are in studio with me today. These are dental specialists, and those that are just joining in now, we've been discussing quite a lot of issues. And when we broke off, Robert, we were talking about the different things we use for cleaning the mouth. I know actually there's a big number of Ugandans who may not afford a toothbrush. So if I cannot afford a toothbrush, are there other options for me? There's quite a big number of Ugandans who cannot afford toothbrushes.
Thank you very much. I'm happy that I'm the one chosen to talk about that because I have a passion somewhere there. Now, all the things that we've talked about, they have alternatives.
Okay.
Just as you have a spoon for the tongue scraper, we also have the mouthwash or the stick for the toothbrush.
Wow.
The most important thing is how do you brush it? Do you brush your last teeth? Because with the mouthwash or the stick, there's a tendency of forgetting to brush the last teeth. So what do? Remember, brush after you brush. Pass your tongue at the back of the teeth.
Wow.
Now
so if I can't afford a toothbrush, I can get particular sticks.
Yes, the mouthwash. Now, I insist, even if you're using the soft toothbrush, however good it is, remember when you're finishing to brush, pass your tongue at the back of your teeth. Have you brushed your last teeth?
Okay.
2, never ever touch charcoal to brush your teeth. I've seen so many people brush charcoal using
salt, soap.
Yes. Now, if you use these rough things, they tend to corrode, and they tend to cause abrasion cavities.
Or make the teeth rough.
They make the teeth rough. So it is not a good idea to use charcoal or just get salt itself and put it in your mouth and start brushing. So what should you do? If you really...
Alternative for toothpaste? We're going to say alternative for toothbrush or alternative for toothpaste?
Before I go into the alternative, never ever touch soap when you're brushing your teeth.
So soap is out. If you've been using soap, it is very dangerous. It will just cause more damage to your gums.
Yes.
Wow.
So what should you do? One, you could use just normal water. The most important thing is remove the food from your teeth.
Mechanically.
Yes. Even if you have toothpaste, the right toothpaste, if you don't clean all the food from your teeth, you're wasting your time. So the most important thing is effective brushing. Remember to pass your tongue over the teeth. Now, you can put a little salt
on the toothbrush.
No, in the water you're using to brush. Remember, when you put the salt on that gun, it will cause abrasions gun.
So the salt should be in the water, not on the top of the bristles.
If you are a person who has bleeding gums, it is okay putting a little bicarbonate of soda in that, then you brush. But if you have bleeding gums, just know there's a problem with your gums. And if you just use the the bicarbonate and the salt and it goes away, remember there's food under your gum this thing will keep on popping up. So it's better you go to the dentist, have those teeth cleaned.
Wow. You come in at you close off at a very, very important point of visiting the dentist. And Nelson is going to be telling us how often should we visit the dentist. Should I only come when I have a problem?
That's a typical African when we visit dentist when you have pain. Thank you so much, Dr. Nyanzi. Just something little about the toothbrush. Remember, I emphasize it should be functional. Toothbrush, ideally 2-3 months, the bristles are beginning to get bent. You should get a new one.
Wow. Every 3 months.
Irrespective of whether you know the right stroke I demonstrated, but using a bent, bristles that are bent, you will not do good cleaning.
Wow. So every 3 months, you should be replacing your toothbrush.
Yes, preferably.
Wow.
So visiting a dentist, really, it has no stipulated time frame that this is the agreed time frame, but it's dependent upon very many factors. But nevertheless, there is what is at least expected from the public and what we expect our clients to at least do as regards dental visits. If you can visit a dentist at least once a year,
Wow.
It takes me to, I was discussing with a senior colleague one day about when should really a client visit a dentist. He said that for him, what he does for his clients, he tells them, you know what, every eve of your birthday, make sure you attend to your dentist.
Wow.
So it's like a reminder to them that I need to go and see a dentist. I've made another year, or I'm making another year. I need to really go and have my teeth checked, irrespective of whether there is pain or no. That's one of the techniques one can apply. But like from my personal experience, for the years I've worked and what I recommend for my clients, at least 6 months, every after 6 months, go have your teeth checked and preferably do a teeth cleaning. People will always tell me, but doctor, you know what, I clean my teeth well, you told me to use the right toothpaste, I'm buying these expensive toothbrushes, and it's okay, but you need to do a teeth cleaning at that point, because irrespective of how best you brush your teeth, there are areas you'll never access and clean well. So I always tell my patients, every after 6 months, come in, have your teeth checked, and then do a teeth cleaning. And then also, most times, take a radiograph, a full mouth radiograph, because there are very many things. You know, a radiograph is...
what is a radiograph?
A radiograph is an x-ray, dental x-ray.
Oh, dental x-ray.
And preferably the one that shows all your dentition, all the set. It really is like the third eye to the dentist. You might come, I inspect, I look at your teeth, I check, I touch, I scratch somewhere, no pain. But then I'm missing out something hidden in between your teeth. So that radiograph or x-ray you take at that point can really help to sort out such issues so that they can be addressed before they can get into the worst case scenarios.
Okay.
Yes.
Nelson, what happens in the dental cleaning when somebody comes to see a dentist?
So when you walk into a dentist for dental cleaning, they're given specific rotary devices that we use to clean your teeth.
Okay.
We have what we call an ultrasonic scaler. It's what we first use
to
clean and try to poke out the stuck food particles and calculus and plaque in between your teeth and off the teeth surfaces. Then after we've used that ultrasonic scaler or cleaner, we polish your teeth using another rotary device.
Wow.
So that's what it involves. Yeah.
At least once every year, you should pay a visit to your dentist. Very, very important. You don't want to turn 60 and you do not have teeth. You know, imagine me smiling without teeth. It will be so, so funny. An appearance. Robert, as we come to a close, maybe about 3-4 bullets, tip. What are those basics for oral hygiene? Just a summary of what we've been discussing. What's summary?
The most important time to brush is before you go to bed. Remember to brush in a circular motion. Avoid brushing like this because it will cut your teeth, and avoid brushing like up and down because it will poke your gums. Remember, the dentists have agreed that we cannot stop you from eating the sweets, but the sweets will always affect your teeth. So what should you do? Always brush after sweet. If you really can't afford, if you don't have the brush around, please rinse your mouth with clean water. Or you can take a sip of water. That sip of water will do a lot. It will do a lot to take away the sugars from your mouth.
Wow, thank you, Robert. Robert, parting shots to Ugandans watching you today. There are all classes of Ugandans watching you, right from the little mother in the village all the way to the head of state. Meanwhile, policy makers, any final words concerning oral health for the Ugandans that are watching you today? Yeah, in a minute.
Oral health has tended to be neglected by the state of Uganda. I really advise them to put a little more effort in the oral health. The dentists need a lot of equipment. They need a lot to work well. That is why a very small percentage are actually practicing dentists. Why? Because they get frustrated in the field, they cannot do what they're supposed to do, and that is why some people end up just extracting teeth.
Okay.
So I, as Chironi Robert, I love to teach. So you can find me on my Facebook page of Dino Dental Kampala or the YouTube channel.
Wow, thank you. That is Robert from Dino, D-I-N-O, Dental. That is the same name on Facebook for more information. Nelson.
Our viewers, thank you for attending the show. Just to encourage you to always follow up on your dental checkups, at least once a year. It can make a difference between you losing the tooth and maintaining your tooth. And then for the mothers, watch out on the bottles. If it's hard to use the bottle, to give up on the bottle, at least make sure, control the sugars in the bottle content, and then follow it up. After giving the bottle, follow it up with some little water to rinse off the sugars. And then brush your teeth well 2 times every day, preferably after meals. And then it's important to brush in the evening before you get to bed, using the fluoridated toothpaste. I will emphasize that, and the well-functioning toothbrush. Please stay well, stay safe. Merry Christmas to all of you. You can follow me on Facebook and also my Twitter handle.
What's your Facebook?
My Facebook is Nelson Peter Kalyasubula, and my Twitter handle is Nelson Kalyasubula.
Wow. For more information, if you have any questions, as well as remember to leave your questions in the comment section below on our YouTube channel and Facebook channel. As we go out for Christmas, as we celebrate, as we go eating left, right, and center, remember, even at 50, even at 60, you would love to smile and everybody sees your dental formula without spaces. So this information we've shared this evening, please share with your friends, share with your family members, encourage them to subscribe to our channels. And as we sign out this evening, from me and the team at Quiz Mali Production House, we want to wish you a very Merry Christmas. May this be a great time of joy, peace, and love with your family members and with your friends. Special thanks to the National Medical Stores that are making this show very possible and available to us, as well as the Camelin Men's Collection that is located at Zebra Plaza on the intersection between Kampala Road and Entebbe Road. Guys out there, please go and get your suits and all menswear affordably, but very, very, very nice stuff. From me to you, bye for now. God bless you. Have a very wonderful festive season. Till we catch up again. Bye.
The Doctalk Show.
Patriotism is a feeling of love, devotion, and the willingness to sacrifice for one's country.
I say no to corruption because I put my country first. I choose peace over violence because I put my country first.
I love Uganda. I serve Uganda. I sacrifice for Uganda. I'm loyal to Uganda. I love myself.
Be patriotic. Uganda first. This message is brought to you by the National Secretariat for Patriotism Co Uganda, Office of the President. This weekend on UBC.
Culture does not make people. People make culture. Now, if it is true that a full humanity of women is not our culture, then we must and should make it part of our culture. My name, as usual, is Drago. I'm pretty excited today to introduce to you a trailblazer. She uses her voice and numbers on Twitter to influence society.
My name's Kembabas Joan. I'm 22 years old. I'm an environmental scientist by profession. I personally believe in a gender equal world. So I just want to see a world where girls
Thank you.